on to our next guest, who is a joy to talk to, and another interview we taped a little while back with our beloved Marie. So you get some wonderful Marie as well as Moji and an abortion provider who is out here doing the most in these Arizona streets.
She's a board-certified OBGYN, clinical professor, women's health and reproductive rights advocate, and founder and owner of Desert Star Family Planning in Phoenix. She's also author of Undue Burden, a Black woman physician on being Christian and pro-abortion in the reproductive justice movement. Please welcome Dr. DeShawn Taylor. Hi, thank you for joining us.
Hi,
Hello.
Dr. Taylor.
Hello. I'm so glad you're joining us again. This is not your first time on the pod, but just to remind our listeners, you're a physician, an abortion provider, and the clinic owner of Desert Star Family Planning. Can you please tell our listeners your personal path to becoming an abortion provider in the state of Arizona?
How I ended up in Arizona is an interesting story, but I am an OBGYN by training. Born, raised, and trained in Los Angeles, California. I did a complex family planning fellowship after finishing my OBGYN residency at the King Drew Medical Center in the Watts Willowbrook area of Los Angeles. Spent a couple years at USC, University of Southern California, doing the fellowship and getting a master's degree associated with that. And I never expected to leave Los Angeles. I had this mission to serve my underserved community as I did my residency training and fellowship training at LA County hospitals, but there was familial opportunities to move. I started to think about what my life looked like beyond what I was doing in the moment. I was an academic physician at the time, and familial ties moved me to Arizona. And I was the statewide medical director of a large family planning provider there. And from there, I started my own practice, Desert Star Family Planning. And the reason that I did that was because over the years of providing abortion care in different settings, an academic setting, in a kind of corporate setting, so to speak, there was this way that I wanted people to feel in the care that I wanted people to receive. And it became very clear that I wasn't going to be able to create that in somebody else's system, and that I would have to start my own practice. I tell you, I asked myself many times, like, what was I thinking when I started an abortion clinic in the hostile state of Arizona during the time where all the restrictions was starting to shrink access to care. So the timing, of course, was great because it added an additional independent abortion clinic to the mix when restrictions were starting to decrease the access to care across the state.
You know, I just want to say I've visited your clinic and it is so beautiful, and it has that feminist warmth of people just looking at you and caring for you holistically. Before we go on, I just want people to know that your vision for what you wanted to bring to abortion care, when you open the door, it's like this wind of support just like pours at you as a person. So I just wanted to thank you for that and for really making that happen for people, because it's huge.
Thank you for sharing that, because every single thing in the clinic was thoughtful. And to the extent that I could control, I really made an effort to want people to feel warmth and welcome and comfort when they come into the clinic.
Well, good job. It's as close to going back into just like an enveloped hug as you could create in a office that I've ever been to. So thank you.
Aww. As Moji mentioned, we're always excited and amped to have you on the pod, but we're doubly pleased today because you just put out a new book, Undue Burden. And we know why you named your book this. We can probably make a guess at why you picked that name. Could you explain the title to our listeners? And right after they got published, we were lucky to get a couple copies.
So Undue Burden is one of the criteria that was created by the Supreme Court to determine whether an abortion restriction could be continued by a state. Basically, there was a precedent set some years ago that if a state was going to restrict abortion, that it couldn't be an undue burden for people in that state to still be able to receive abortion care. In various instances, if, say, there was only going to be one clinic left in a state that would be able to provide care, then if the law caused that clinic to close, then that would be an undue burden. Now, let me tell you though, the amount of time that somebody has to travel to a clinic is not part of the undue burden standard. It really is about, is there any provider in the state that actually would be able to provide the care? So that's why we've been able to see a lot of laws pass and stand in some instances, because there is still one clinic left in the state. And then we've also seen some things get stricken down because it would close the only provider in the state. So it has gone both ways.
You know, that feels so nostalgic.
I know.
Right? I mean, I remember when, one of the first times around with Mississippi, and one of the things the court said was it is an undue burden to leave people who need abortion care in a state with one clinic. And we seem so far away from that right now. I'd love for you to talk a little bit about, where is the moral floor? Do we even have a common, compassion spot anymore? That also, it just feels like it's gone.
I will share with you all in your audience something that I've been thinking a great deal about. And that is, although most Americans believe that people should be able to make decisions they need to make about their bodies, there is a large population of people in this country who are okay with bans. And so that is what we have to reckon with as a movement. How do we talk to people who actually think that bans are okay? Like philosophically, they're like, people should be able to get an abortion when they need it, but they're not connecting the dots about what bans mean for people's access. And so the moral ground around this has always been, but we've always counted on people at least understanding that, people should be able to make decisions about their bodies. But what we're seeing now that's playing out with Roe gone is the complexity of that philosophical idea.
And I think, we talked about this on the podcast a lot, in the fact that when we hear the right wing shift, because they've seen Americans hate these bans, right? They're like, this is terrible. So then we hear these compromises, and they call them compromises, and they call them consensus. A 12-week ban is fine, or, and we often like to say, like, no ban is fine, because no country that decides they have a law or a rule or a line that government intervention is okay in your bodily autonomy. To me, I think we need to really talk to the public about the fact that all of that is extreme.
Yes, and what I learned in the last couple of years that blew my mind, because I'm an OBGYN, I'm a complex family planning trained person, and I did not know that the trimester system was a legal construct and not a medical construct. We've essentially, when Roe v. Wade decision was handed down in 1973, the Supreme Court created the trimester system so that they could balance the state's interest in perinatal life of a pregnant person against their ability to obtain an abortion. And the medical system co-opted that. And for decades afterwards, we're teaching this like this is medical science. There is no science to this. We've kind of built on this kind of padding, right, to this decision to make it make sense, from a scientific standpoint. But, at its core, it was not a scientific or medical construct. And once you know that, every person who I say this to, they're mind blown, just like I was. Once you realize that, then you really have to start to understand that what matters here is, should a birth happen? And when we're looking at things from that standpoint, it starts to be clear that people should be able to make the decisions based on their bodies, their lives, consultation with the healthcare professionals that they choose, because the trimester system is not based in science.
I think I really love that you brought that up, because I also recently found that out, and my mind was blown, because I was like, okay, so Roe existed in this country for 50 years, and I don't know at what point people stopped recognizing that that was a legal construct and not a medical construct, because my whole life, which is just under 50 years, it has been, and I just assumed that was so. And it also makes me afraid, especially as laws are being enacted now, what people will have forgotten, in 20 years, in 30 years, depending on how our laws change. You talk about how the term pro-choice is not now and has never been enough. And I think, again, everyone in this conversation has known that can you explain this in like common sense terms for people who maybe have not thought about that? Because even on our social medias, we get pushback when we say we're pro-abortion. And it's like, what do people need to know about why the phrase pro-choice doesn't work?
So I will share with you what I have learned over time. And what I have learned over time is that people who push back and say no one is pro-abortion, I'm pro-choice, those are actually the people who fall into a couple of categories. One category is social acceptance. They're not comfortable because the narrative hasn't been created to make them feel comfortable in saying that they're pro-abortion. There's so many people who are pro-choice that can't say the word abortion. So some of it is social acceptance. But there is the other group of these people are people who are actually okay with choice with limits. And so those are the pro-choice people who definitely want that 10-year-old to get an abortion, definitely want that rape victim to get an abortion, definitely want that person with that lethal fetal abnormality to get an abortion, definitely want that person who will die if their pregnancy continues to get an abortion. But otherwise, these people who have been going on about their lives, becoming unintentionally pregnant because they enjoy sex and they want to have an abortion, those people might have a problem. There might be a problem there. And so that's why I am strongly encouraging people who are actually pro-abortion but scared to say it, to step into that, because I'm pro-abortion, but I'm not going and knocking on people's doors and saying, hey, do you want an abortion today? I am providing a safe space for people to come and receive that care in a way that affirms them as a human being. And so just like you would be pro get that appendectomy before your appendix bursts, then you should be pro-abortion because abortion is healthcare and abortion is essential.
I love that. And I think of all the conversations that I have with ladies who look exactly like me, that is what I say. And I often say to them, have you ever unpacked why you say that? Because A, how do you defend abortion if you A, can't say it? And B, how do you think it makes me feel as somebody who's had more than one abortion? How do you think that makes me feel? It doesn't make me feel like I want to confide in you. It doesn't make me feel like you're a trusted person. And if you really do believe that abortion access is and should be available to everybody, then you need to name it. And like you said, lean in so that the people who are coming to you and talking to you about abortion will feel safe and comfortable.
I was at a conference recently, and I think it was maybe the first time that abortion was addressed in that body of people at that conference. And some really, really spirited discussion ensued, much longer than was expected, and they left space for it in that space. And I ended my comments by saying, and we hear this a lot because we say this a lot, we all know and love someone who's had an abortion. And if you don't think you do, then that means you are not a safe person for the people you love to have this conversation with. And I really need you to think about that.
Yeah.
I had more of a technical content-based question. While you were writing this book, a lot of things were shifting and moving in the background. So I'm just curious, purely from like an editing perspective, how did your priorities maybe change or not change while you were writing Undue Burden, as major events like the leak, Dobbs happened, while you are being a person unto yourself, a physician, a clinic owner, a human being? How might have those book topics changed or were further solidified and cemented for you?
So I started the book concept in February, and I kind of had an idea about a title. It wasn't Undue Burden, and I had an idea of chapters. By the time I had the second meeting about the kind of the concept, I had already made changes. I did start writing, and we were writing during the leaked draft. And so once the draft leaked, then, we were marking places where we had written things about being able to go back as things were like happening in real time and make some adjustments. And then it became a situation where I needed to write about how I was feeling, what was going on, what I was thinking in the moment. The book was being written kind of loosely based on the chapters that I had created, but it was really me having therapy with myself, going through and voicing how it's feeling and what I think people should be doing and, all of these things. And then ultimately, I was actually still writing when abortion was illegal for those couple of weeks in Arizona. So I think I finished right towards the end of September. Then we kind of sat down and was like, okay, these chapters should be consolidated. This is that. And I would say we probably figured out the name somewhere kind of in the middle of writing. And I definitely felt that, Undue Burden was important, as I was like, this is ridiculous. What happened to the Supreme Court? What happened to President? All of these things. And then I also wanted all the different identities that I hold to be present in the book. So that's how the title came about. But yeah, it's a very different book at the end than what the initial concept was set out to be.
Dr. Taylor, the thing that I think I'm happiest about you writing this book is because of your identities. You're a Black Christian OBGYN who provides abortions, right? And I want to ask you a two-parter. The first part is when we watch the media, and even well-intentioned media, we never hear the stories of providers. We kind of hear the horse race about abortion. We hear about the politics around abortion. What do you want people to know about what it means to be an abortion provider and who abortion providers are? And two, who would you like to read this book? Who needs this book the most?
I think that the people who need this book the most are the people who need to be affirmed in what they truly believe, but are afraid to outwardly speak. Because in each chapter, I end the chapter with myths and language for people to use to talk about these things. And so it's really as a primer for gathering a little bit more information to understand what the issues really are, and then actually calls to action in ways that you can actually move that needle for yourself to be able to actually be more outspoken and use language that, people can relate to, that resonates with people. What people need to know about abortion providers. Honestly, people who provide abortion care are some of the most conscientious, caring, wonderful human beings that exist in the world. Like, I'm affirmed by this every day. Of course, as in any profession, you have folks who can be questionable. I have had so many people who have worked and trained with me who say being an abortion provider makes me a better doctor. And I think that is absolutely true. You learn how to listen to people. You learn how to meet people where they are. You learn how to obtain information from people in a way that really helps them make decisions that they need to make in their lives, which can be very challenging, not necessarily from a logical standpoint, but there are so many external societal inputs that people are struggling with beyond their own personal needs for their lives and their bodies. And so, being able to navigate that, it takes a deep empathy that abortion providers have.
Well, it's been so great talking to you, and I am so thrilled every time we talk to somebody who finds their way to abortion provision because of their faith, not in spite of their faith. And I think that you embody that. And we need more people like you just out there in the world. I just want you to put you on a platform so we can say to people, this is what a real Christian looks like right here. This person is living the values of Christianity in a way that is profound and amazing. So thank you for the book, Dr. Taylor. Thank you for everything that you do and for practicing in a place where it's hard right now and for sharing your story.
Thank you guys for having me. It's always a pleasure to see you all.